you ever wondered if there is or what a natural relief or prevention is for cold sores? Hello, my successful and healthy earthlings. Mihaela Ragush here, naturopath and founder of the Natural Health Podcast. In this episode today, you will learn just how you can ensure to reduce the amount of cold sore outbreaks. And at the end of this episode, I'm going to give you an opportunity to join a natural health newsletter, a community that's surrounded about health and success by clicking the link below and joining. Welcome to the Natural Health Podcast, where we bring awareness to sustainable health in the business hustle space. The Natural Health Podcast is perfect for the high-performing business-minded individuals who want to work with their biochemistry to achieve success and optimal health. It's Wednesday, which means it's time for What Would I Do? In today's episode of Natural Health Podcast, we discuss this week's question or questions I kept confidential. I'll read them and answer them as if it was me. Hence why it's called What Would I Do? The information provided is not to be taken as advice and is solely for information purposes only. I'm not here to cure, treat, or provide medical advice. I'm here to educate and inform you so you're able to take steps towards optimal health. Please discuss any medical issues or healthcare changes with your healthcare professional. Let's get into today's question. Clearly, we know it's about cold sores, but what is it, right? It says, I have been getting cold sores for the last 10 years of my life, and recently they have been very common. I get one every second week. What can I do to reduce the breakouts naturally? What an absolutely great question. So many individuals have the Herpes Simplex Virus. Let's look into it. What is a cold sore? That's why I kind of already gave you that away, didn't I? Well, cold sores come from the Herpes Simplex Virus. It is a viral infection and it's caused by HSV, and mainly there's HSV1 and HSV2. So the viral pathogen HSV1 is associated primarily with oral and labial infections, and HSV2, which causes mainly genital lesions. But here we're talking about HSV1. HSV1 transmission occurs by direct contact or contaminated saliva, and HSV2 infection is spread vaginally, anally, or oral sex with someone who has the virus. Well, both of them, someone has to have the virus, right? So the primary goal of treatment is to promote immune function, to reduce viral activity, and also induce viral dormancy and support healthy immune system to prevent the reactivations, because individuals who have this virus, it's inside of them all the time. It's either dormant, which is kind of like asleep, or it's wide awake and it's activated and you know when it's awake if you do have it, right? The key drivers for it are immune suppression, where your immune system is lowered. Where your immune system is suppressed. Apologies about that. It's suppressed and it's not working, right? Immune exhaustion, stress, sunburn, UVB exposure, and also nutrient deficiency. So many things that impact the HSV activation of your cold sore. So you say you get it every second week. It's kind of like, well, is it because of immune suppression? Is it stress? Is it sunburn? Is it nutritional deficiencies, right? But let's get into some questions, right? Now, I already started a little bit, but let's go into it a little bit deeper. When are your cold sores at its worst? I don't know if I didn't see if you're a female or a male. I didn't click onto that. But if you're a female, is it around your period? If you're a male, is it when you're working? Is it when you're stressed? Is it when you're out about drinking a bit more? Same as females. What is it? What makes it worse and what makes it better? When do you not get the outbreaks and when do you get the outbreaks? Currently, when you are getting the outbreaks, what is your diet like? Is it filled with junk food or is it really healthy? What's that diet looking like? What's your sleep like? Are you going to sleep 2, 3, 4, 5 a.m. or are you going to sleep about 9, 10, 11 p.m.? And when are you waking up? But not only that, is you sleep deep, right? Are you currently hydrated, or are you keeping hydrated? And I know here in Australia, we're in winter, so it's a little bit hard for people to stay hydrated. It's a big issue we have. But are you keeping hydrated, or are you just not really? And what is your trigger? Some people actually know their trigger. For some people, they go, every time I go and on a holiday, I get a cold sore. Every time around financial year, I get a cold sore. Every time it's summer, I get a cold sore. So for everyone, it's different. Figure out what yours is. Are you stressed at the moment when it comes on? Is there a lot of stressful things occurring, or are you going through a stressful stage at the moment? Do you have an autoimmune disease? Have you had that looked into? Is there an autoimmune disease there? Are you on any types of medication that may be suppressing your immune system? Are you in immunosuppressive treatments such as corticosteroids? Do you have other viral infections? Is there anything else that may be happening inside of your body? Is there a toxic load? Like, what do you do for a job? Are you a painter? Are you a hairdresser? Is it toxins in the air with what you do, right? Or at home, is it toxins? Did you newly just renovate your place? Are you living near a petrol station? Did you just move to a new home and it's right near a factory? Anything along those lines. Have you had your omega-3 levels tested? Absolutely necessary. What is your food intake like, and do you have nutritional deficiencies? So do you have any other diseases or any other infections like I mentioned, or anything else that may be happening, such as hypothyroidism, other autoimmune diseases, rheumatoid arthritis, Lees, and so forth? What is happening inside of your body? These are some of the questions you can ask yourself. There's so many more, but these are kind of like, let's keep it simple. What would I do? Okay, so if I was breaking out of cold sores every second week, the number one thing I would do is I would ensure that I have a low arginine and high lysine diet. What does that look like? Okay, so high arginine, we need to avoid. So high arginine foods induce more cold sores, and this has been proven. So I'm really going to say some foods that if you're like, oh my gosh, I eat these all the time, then be wary. Okay, we got nuts, any nuts, peanuts, gelatin, found in lollies, right? Chocolate, carob, coconuts, seeds, oats, whole wheat and white flour, lentils, brown rice, dried beans, including soybeans and tofu, wheat germ, and there are other ones also. So all you have to do is, if you want to know a whole list, check it out, look up high arginine food and ignore them. Try to reduce them as much as possible and have high lysine foods. And some people actually need to supplement with a good L-lysine supplement that is recommended by the healthcare professional. Some nutrients essential to your immune system, you ready for this one? For your immune system include vitamin A, C, D, E, B6, B12, B9, also iron, copper, selenium, and zinc. That is a lot, right? So this is what I'm saying here, to ensure that you're eating a real high variety vegetable diet, because if you do, you will hit all those vitamins and minerals. Yeah, that's a lot right there, but you need to look up foods that are high in vitamin A, C, D, E, B6, B9, B12, iron, copper, selenium, and zinc. This is something that's absolutely necessary. The other thing is also some herbs that can assist are astragalus. Astragalus herb can help and can assist these individuals with their immune system function. And sleep. Sleep is absolutely key. Individuals who are not sleeping have more cold sore outbreaks. So this is where your sleep needs to be on point, and not just laying there for 8 hours. You need to be hitting all 4 stages of sleep: deep sleep, REM sleep, non-REM sleep, light sleep. You need to hit all of them to ensure that you have an adequate sleep, right? Ensure that your microbe gut is on point, because your immune system is in your gut. I've said that so many times. Your immune system is on your gut. For some individuals, they actually need to be on probiotics to ensure that they repair their gut. Because if you've been on antibiotics, your gut has been destroyed. Well, that's a bit dramatic, but has been injured in a way. You need to ensure that, it's kind of like when you're thinking now, it's like, well, did I take that antibiotic and then I got the cold sore, and then that's what? Making those links slowly, aren't you? You're making those links. We need to increase the intake of microbe-enhancing foods to nourish the gut flora. Ensure that the gut is loving us and we're loving the gut, right? Avoiding things like caffeine, alcohol, sugars. These are things that are going to trigger us onto the pathway of activating the herpes virus. And also we need to ensure that we're mindful and wary of other people around us, because now that you do have this virus, we need to ensure that you reduce the contagious spreading. And that is that you don't share your drinks with other individuals, that you don't share your cutlery with other individuals. Just be wary, because you have this virus now. It's easily for you to spread it on to other individuals. And if you have a partner, ensure that you do keep their hygiene there and they're aware that you have the virus. So this is something to keep in mind of, and for you to ensure that you strengthen your immune system so, it stays dormant. Just because you think it's dormant, you still have it. Doesn't mean it's gone. It's in your body. You have this virus in your body. So just be wary of that, and it can come up at any time. The thing to watch out for is rheumatoid arthritis, Alzheimer's, meningitis, and STIs in pregnancy. So these are the key things for you to take care of, because individuals who have this herpes virus are more likely to get it. I'm going to give you a little bonus right here, because I know how annoying having the herpes virus cold sores is. It could be so annoying and frustrating. So if you currently, this is not medical advice, this is something for you to talk to your healthcare professional. If you currently have a cold sore, a cream, vitamin E based cream mixed with licorice and lemon balm, put on there, does wonders. Okay, if you can get your naturopath to make that for you, that would be absolutely amazing. The other things that help out also is applying apple cider vinegar, L-lysine, citrate, GSE applied to cold sore directly, grape seed extract. These apply to it directly. You can also if you have an outbreak and the moment, 1,000 vitamin C's 3 times a day, 1,000 lysine 3 times a day, 30 milligrams of zinc, including some NAC and maybe even some selenium there may assist. This is not medical advice. This is at your own risk if you want to take it. It has been proven to assist with cold sores after talking to a natural healthcare professional, of course, and then prescribing this to you. The reason why is with the lemon balm, studies have shown the lemon balm helps protect against herpes simplex virus. They also found that treating a cold sore with lemon balm in its early stages was most effective, which is amazing, right? This is why I love herbs. And also licorice root has antiviral and antibacterial abilities. Its antiviral properties help prevent viruses from replicating, while its antibacterial properties inhibit bacterial function. There you have it. I know I went overboard, but I did it just for you individuals who have a cold sores and who have the herpes simplex virus. These are ways to decrease it. I hope that this sheds some light to your question. Anyone's listening who may have this issue. If you have any questions, please feel free to contact me at mahela.raguse on Instagram, and I'll be in touch with you and hopefully be able to answer your questions via the podcast. But if you love these questions, you want more of it, you want more health research, you want more bonuses, specials from guests, you have to sign up to the Natural Health newsletter. Link is below. Jump on it. And remember, the missing link between failure and success is your health.